What if your child's bad sleep is not bad behavior? Snoring, restless nights, morning headaches, bedwetting. A kid who wakes up tired, angry, or wired like they drank espresso. Let me be clear, kids are not supposed to struggle for air while sleeping. And if nobody checks it, the whole family pays. Not just at night, at school, at the doctor, at the breakfast table. In every meltdown that gets called discipline before anyone asks, did this child actually sleep? This is not about blaming screens, sugar, lazy parenting, or kids these days. That is the cheap answer. Here's the truth. Some children are exhausted because their sleep is being broken all night, and nobody sees it because it happens in the dark. Parents hear snoring and think, that's normal. It is not always normal. A pediatric sleep study, also called a polysomnogram, is not some dramatic hospital punishment. It is a monitored overnight test that records what the body is doing during sleep. Breathing, oxygen, heart rhythm, brain waves, leg movement, sleep stages. Nobody tells you this. A child can spend 8 or 10 hours in bed and still get terrible sleep. Time in bed is not the same as recovery. That is the first myth we have to bury. Picture this. A 7-year-old is difficult every morning. They fight waking up. They melt down before school. Teachers say they cannot focus. At night, they snore through the wall. The parent thinks, maybe ADHD, maybe anxiety, maybe too much tablet time, maybe sugar. Then the child starts wetting the bed again. They wake with headaches. They sleep with their mouth open. They toss, kick, sweat, and grind through the night. One symptom looks random. Several symptoms form a pattern. And here is the uncomfortable part. When adults sleep badly, we call it a health problem. When kids sleep badly, we often call it attitude. That mistake can waste months, sometimes years. A child who is not resting may not look sleepy. They may look explosive. A pediatric sleep study helps doctors find out whether a child has a sleep disorder, especially sleep-disordered breathing, or obstructive sleep apnea. In pediatric obstructive sleep apnea, the upper airway becomes partly or completely blocked during sleep. Breathing can pause, oxygen can drop, and the brain may keep waking the child enough to reopen the airway. The child may not remember waking, but the body remembers. Poor sleep can show up as hyperactivity, irritability, poor concentration, morning headaches, growth concerns, and daytime tiredness. Some children do not look sleepy. They look wild, emotional, or impossible to manage. That is why guessing is dangerous. A sleep study does not judge the child. It measures the night. Why does it happen? Sometimes enlarged tonsils or adenoids narrow the airway. Sometimes nasal congestion, allergies, obesity, craniofacial differences, neuromuscular conditions, or other medical issues raise the risk. Let me be clear, this is not only an adult problem. Children can have sleep apnea too, and they may not present like adults. Adults often complain of daytime sleepiness. Kids may bounce off the walls because their tired brain is fighting to stay awake. That difference fools people. And if the child also has weight concerns, blood sugar concerns, learning issues, or behavior struggles, broken sleep can make the whole picture harder to manage. You cannot optimize a child's health while ignoring the hours when their brain and body are supposed to repair. Stop asking, does my child sleep enough hours? Ask, is my child breathing well while sleeping? Those are not the same question. A child can be in bed for 10 hours and still have fragmented, poor quality sleep. Watch for loud snoring, pauses in breathing, gasping, choking, mouth breathing, restless sleep, unusual sleep positions, night sweats, bedwetting, morning headaches, daytime behavior problems, and school struggles. One noisy night after a cold is different from a pattern. Here's the truth. If snoring is frequent and paired with daytime problems, it deserves a real conversation with a clinician. Do not let they will grow out of it become a sedative for your instincts. So what should parents actually do? First, record the pattern. Make a simple sleep log for 1 to 2 weeks. bedtime, wake time, snoring, pauses, gasping, mouth breathing, headaches, bedwetting, daytime mood, school issues. Second, take a short video of concerning breathing during sleep, if it is safe and respectful. Do not shake the child awake unless they are in distress. Just document what you see. Third, talk to your pediatrician. Use direct language. My child snores frequently, seems tired or dysregulated, and I am worried about sleep-disordered breathing. Should we consider a sleep evaluation? A sleep study may use sensors on the scalp, face, chest, finger, and legs. It may feel weird, but it is usually non-invasive and painless. Bring pajamas. Bring a comfort item. Bring patience. The goal is not to scare the child. Now comes the part most parents misunderstand. A sleep study is not just about proving snoring. It can show how often breathing is disrupted, whether oxygen drops, how the heart responds, how sleep stages change, and whether movements are fragmenting sleep. Think of it like checking the engine while the car is moving. During the day, a child may look fine enough. At night, the truth can be different. The sensors are not there for decoration. They help reveal whether the brain, breathing, oxygen, heart, and muscles are working together or fighting each other. That information matters because treatment depends on the cause and severity. Some children may need evaluation of tonsils and adenoids. Some may need allergy treatment, weight-related support, positive airway pressure, orthodontic or airway evaluation, or follow-up with sleep medicine. Same snore, different reason, different plan. That is why copying another parent's solution from Facebook is medical roulette. Your child needs interpretation, not internet improvisation. Reality check. Ignoring sleep problems can get expensive. Not just money. Attention, school performance, family stress, doctor visits, behavior labels that may not tell the whole story. But panic is not useful either. Not every snore is sleep apnea. Not every restless child needs a sleep lab tomorrow. The middle path is calm urgency. IF symptoms are frequent, worsening, or affecting daytime function. Ask for help. And please, do not replace evaluation with mouth tape, random supplements, sleep gadgets, or internet biohacks. For a child, let me be clear, kids need medical guidance, not experiments from comment sections. Your child's airway is not a trend. Neither is their oxygen. Here is the hopeful reframe. A pediatric sleep study is not a failure. It is not overreacting. It is a flashlight. It helps parents and doctors see what is happening while everyone else is asleep. And once you have data, you can stop guessing. Maybe the answer is simple. Maybe it is not. But either way, information beats blame. And here is another detail parents miss. A sleep study is not only for the child who snores like an adult. It may be considered when symptoms, medical history, or exam findings suggest a deeper sleep problem. That includes kids with complex medical conditions, unusual nighttime breathing, or daytime problems that do not match the usual explanation. If your child is struggling, you are not weak for asking questions. You are not dramatic for noticing patterns. You are not that parent for wanting your child to breathe, sleep, learn, grow, and wake up like their body actually recovered. That is advocacy. And sometimes, one night of monitoring can explain years of chaos. It can turn "my kid is impossible" into "my kid needs help sleeping safely." This video is for education only. It does not diagnose, treat, or replace advice from your child's doctor, pediatrician, sleep specialist, dentist, or emergency clinician. Seek urgent care if your child has severe breathing trouble, bluish lips, extreme sleepiness, confusion, or any emergency symptoms. If you want clear health content without sugarcoating, subscribe. Leave a comment with your questions or suggestions, especially if you want a video on pediatric sleep apnea signs, tonsils and adenoids, CPA SIBIT for kids, or how to prepare a child for a sleep study. And watch the next video, because we are breaking down the child's sleep symptoms parents keep dismissing until school, mood, and health start falling apart.